Welcome to today's webinar. Raw Materials Revealed is presented by Cynthia Pickens, Chemistry Laboratory Supervisor with ARL Biopharma. Cynthia brings 20-plus years of experience in the healthcare industry in research and clinical management. She holds a master's degree in chemistry and an MBA from the University of Oklahoma. She obtained her undergraduate degree in chemistry from Southwestern Oklahoma State University. Today's webinar is accredited through ACPE and is worth 1 CE credit hour. CE credit is applied following completion of an evaluation link found on the last slide in the presentation handout. You can find the handout on the lower portion of the GoToWebinar toolbox under Handouts. We are recording this session and will include the recording and evaluation link in a follow-up email. Questions may be submitted throughout the webinar using the GoToWebinar toolbox on the right side of your screen under the Questions tab. We will answer the questions submitted following the presentation. If we do not get to your question today, a list of questions and answers will be emailed to all attendees following the webinar. Thank you for joining today's session.
Thank you, Amy, for that nice introduction. As Amy mentioned, I am the supervisor of the chemistry lab at ARL. The chemistry lab is primarily focused on compendial testing of raw materials. Other than working for ARL, I have no financial interest with any companies or products mentioned in this program. As has been mentioned, this lecture has been approved for 1 CE credit that you can take advantage of by following the instructions provided. And this is additional accreditation information that you may find useful. During the lecture today, we are going to focus on raw materials and the testing of those materials toward ensuring that they meet USP specifications. There are a number of definitions that are associated with raw materials. The two most important that we will be discussing in this lecture are active pharmaceutical ingredient, which is any substance or mixture of substances intended to be used in the manufacture of a drug product, and that when used in the production of a drug becomes an active ingredient of the drug product. And there's also raw material, which is a general term used to denote starting materials, reagents, and solvents intended for use in the production of intermediates or API. When trying to source your raw materials, you will need to purchase them either from the manufacturer directly or from a repackager. The manufacturer is the entity that synthesizes or extracts and purifies the material. The repackager is an entity that obtains the product and then places it without changing it into other containers of various sizes that are more convenient for the purchase by the pharmacist. There is also an entity referred to as the broker who can act as a repackager but typically acts as a go-between between the manufacturer and the repackager. There are 3 raw material classifications. The pharmaceutical grade raw material is what we are focused on today, and these are governed by USP, EP, and JP compendia, among others. There's also a food-grade material, which is meant for human consumption. It is governed by the FCC compendia. FCC is actually owned by USP as well, and both compendia actually share many of the testing procedures, but the specifications are often different. Finally, there's the feed-grade raw materials, but I have no familiarity with this grade of raw material, so we will not be discussing it during this lecture. Pharmaceutical raw materials often do not come from the United States. There is a dearth of manufacturers in the U.S., so it becomes necessary to look abroad when trying to purchase them. Most of the products we test in our laboratories originate in China, though there are a good number of them that originate from India as well. And while brokers and repackagers tend only to purchase from FDA-approved laboratories, the inspectors cannot be there all of the time. So it is important to ensure that the product that you are receiving meets USP specifications, and you do that by submitting your material for testing. The first thing that the testing laboratory is going to do is to purchase standards to test your materials against. There are 2 types of standards. Primary standards are the standards that have gone through very rigorous testing to ensure that they meet specifications. USP sends out their materials that they are planning to use for standards to several laboratories. All of the results from each lab are sent to USP, and they use that information collectively to determine if the product meets the requirements to be certified as a standard. These primary standards, once they are approved, are purchased directly from USP. Oops, went too fast. Sorry. Secondary standards are the APIs that are often certified as UP or EP reference material and are often used in support during testing as control material. These are generally available from reputable vendors. This is the C of A of a USP primary standard for lidocaine hydrochloride. Lidocaine hydrochloride is the sample that we'll be following through the course of this lecture. You can see that this C of A does not look like most of the C of A's that you have experience looking at. What this document is saying is that this standard is certified and it meets the specifications outlined in the monograph. The second page of the certificate is a copy of the label that is put on the standard vial, and it tells things we need to know during testing. In this case, the label is telling us that the material is the monohydrate form, and when it is used in quantitative analysis, that we have to correct the concentrations that we prepare by a value of 0.937 to obtain the correct concentration of the material. It also tells us to protect the material from light. The C of A for the secondary standard looks more like what you are used to seeing. In this particular case, it is 6 pages long and provides a great deal of detail about the quality of the product. I pulled out the 4th page just so you can see some of the types of tests that were performed on the product. Secondary standards are considerably less expensive than primary standards, but I must stress that they cannot be used as a standard for compendial testing. They can, however, be used as control samples during the testing, and they can also be used for non-compendial testing. This is the C of A for the sample that we're going to be talking about today. This is the manufacturer's C of A. When testing your material, we don't typically examine the manufacturer's C of A. However, there are some times we may ask you for it because we may need to get some information, and I'll provide an example of that later in the notes. On this C of A, I have redacted the name of the manufacturer at the request of my client, but what I can tell you is that this product originated out of India. The C of A lists all of the tests that were performed on the sample, the results of those tests, as well as the specifications, which should match USP if they are claiming that the material, I need that mouse, please. If they are claiming that the material actually meets the USP requirements, and they are right here in this conclusion comment. This is a Repackager C of A. This is for the exact same material. It is not uncommon for the repackagers to create their own C of A, which they will provide with their product or upon request. When duplicating a manufacturer's C of A, they are required to indicate the source of the material, which they have done here, which has been redacted, and they have to certify that this is a true copy of the manufacturer's C of A, and they have done that down here in this bottom line. This particular repackager, also informs you that they have performed verification testing on all the tests that have asterisks next to them, and those are over here next to the test names. So as we begin testing the lidocaine hydrochloride, we pull the USP Monograph. The monograph lists out all of the tests and specifications for each test to be performed in a full testing situation. There's actually minimal amount of instruction in the monograph itself, but each of the tests are backed up with general chapters that provide more specific instruction. You can see the bracketed numbers next to the test name. Those numbers correspond to the general chapter that outline the basic instructions for how to run the test and the requirements for any instrumentation used in that testing. So for lidocaine hydrochloride, we have a series of identification tests. We have an assay. We have a series of impurity tests. And then we have some specific tests related to this API. Now, there are also a series of microbiological tests that need to be run that are outlined on the monograph. We're not going to focus those today. We're only going to be talking about the chemistry itself. And then, of course, there's also information about packaging and labeling and the list of the standards that are used in the monograph as well. So the first series of tests are the ID tests. And the purpose of these tests is to do exactly what you would expect them to do, and that is to identify the product. So these are the ID tests that are outlined in the monograph. We have 3 of them, ID A, ID B, and ID C. These are an IR, a retention time match from the assay, and chloride test. Okay, the IR test is a spectroscopy test. There are several different spectroscopy tests, but they all operate in the same manner, in that you have something that emits a specific wavelength of light, or electromagnetic radiation, if you prefer. That emission hits the sample, which excites the sample, and it will either excite the electrons or the atoms or the bonds in some fashion or the other. And that excitation is picked up by the detector, and that's usually interpreted into some form of an output. Okay, for an IR, or infrared wavelengths, which are to the right of the visible spectrum, it's the bonds between the atoms that are actually excited, and the light running through the sample makes those bonds wiggle and stretch and contract, and those movements are what are captured by the detector. The different functional groups on the molecule wiggle and stretch and waggle and contract, all in a specific location at the wavelengths, and so we can actually plot those movements on the spectrum. So in this particular spectrum, which is our lidocaine hydrochloride sample that we're looking at, we have a secondary amine, and we have a tertiary amine, and we have a carbonyl. These are the functional groups associated with the molecule. These peaks in this area of the IR spectrum are the peaks, or I guess they're bands, not really peaks, associated with the NH bond as it moves during excitation. This band right here is associated with the carbonyl right there. Okay, then we have this special section right here. This is referred to as the fingerprint region. This area is unique for every organic compound. Because of this uniqueness of the fingerprint region, in combination with the functional groups over here, the IR is probably the most powerful ID test we have in our arsenal of tests. We can compare the spectrum of our sample to the USP standard and use that comparison to determine if they are the same. In this IR spectrum of lidocaine hydrochloride, the red line is the sample, and the blue line is the standard. And the standard was actually not analyzed exactly on the same day. The sample itself was analyzed in February, whereas the standard was analyzed the previous July. Despite that difference in the time that these were analyzed, we have a 98.2% match between the sample and the standard. Now, if that match had been less than this, then the first thing we would have done is rerun the standard, because minor things in the environment can make small changes, and that's really why these don't match up absolutely identically. If it was raining one day, or someone is breathing over the instrument, then that can change, some of the bands of just a tad from one to the other. And so if you don't get a good match when you run this, the first thing you do is rerun the standard. And then from there, there's other steps to do. We may need to recrystallize the material or something of that nature. So by having a 98.2% match, we can unequivocally state that the sample and the standard match the lidocaine portion of the sample. The next test listed in the ID test is the retention time. This is a match between the standard and the samples during either an assay or a chromatographic purity, or maybe even in a TLC, where the sample and the standard are actually come off of the chromatogram at very, very nearly the same time. In this one, the standard retention time is 4.698, which we're going to round to 4.7, and the sample is 4.693, which we're going to round to 4.7, and so these have an identical retention time match. Now, USP puts a caveat on it. They say that the coincidence of retention times in the sample and reference substance can be used as a partial criterion in construction of an identity profile, but may not be sufficient on its own to establish identity. Absolute retention time of a given compound may vary from one chromatogram to the next. So what we have with the IR test and the retention time match is a fairly good match and identification for the lidocaine portion of the molecule. However, this is not lidocaine. This is lidocaine hydrochloride, and so that means that we have to do one more test. So the last test in the monograph is the chloride test. The IR is a very powerful and strong tool for organic molecules, but it cannot pick up inorganic. It cannot pick up inorganic ions. So the chloride test is put into the monograph so that you can distinguish between lidocaine and lidocaine hydrochloride. The chloride test is a wet chemical technique. The monograph reads, meets the requirements. This doesn't actually tell us a great deal, and so we have to turn over to Chapter 191, and this is what 191 chloride actually says. So we will read those instructions and we will follow them, but these instructions are not straightforward. They require a bit of interpretation. So as an example, let's read through this together. With silver nitrate test solution, or TS, the solution of chloride yields a white curdy precipitate that is insoluble in nitric acid but is soluble in a slight excess of 6-normal ammonium hydrochloride. So that's nice, but the problem is that with solutions of chlorides, we don't have any idea what concentration we need to provide in order to run this particular test. So let's keep reading. So we've added the 6-normal ammonium hydroxide. When testing an amine, including alkyl hydrochlorides that do not respond to the previous test, add 1 drop of dilute nitric acid and ½ ml of silver nitrate to the solution of the substance being examined, containing, unless otherwise directed in the monograph, about 2 mg of chloride per 2 ml of solution. So we had to read over halfway through the instruction here to even get the concentration that we needed to prepare in order to run even this first sentence in the instruction. So we're going to make the sample of 2 mg per 2 ml, okay? And then we're going to add silver nitrate to it to produce the curdy precipitate. But then we have this statement here that says, but it's insoluble in nitric acid and soluble in an excess of 6-normal ammonium hydroxide. So that means that we really need to take that solution and split it up into 2 test tubes. So we split it into 2 test tubes. We're going to add the silver nitrate. Then in one tube, we're going to add nitric acid, and the precipitate should dissolve. And in the other test tube, we're going to add an excess of ammonium hydroxide, and the nitric acid, it does not dissolve. And when we add the ammonium hydroxide, it does dissolve, unless it doesn't work. And in this particular test, it isn't going to work. And the reason it isn't going to work is because we've already established with the structure you saw by the IR that this is an amine. So when you're testing an amine, then you have to add 1 drop of diluted nitric acid and ½ ml of silver nitrate to the solution, which means you really needed to have gotten 3 test tubes instead of 2 test tubes. So you take your sample that you've prepared, and I always tell my analysts to make more than 2 mils. So you can always add up. So you could do 4 mgs and 4 mils or 6 mgs and 6 mils. As long as the ratio is the same, you're okay. So then they would take a portion of this solution and put it into a third test tube, and they would finish the test by adding the nitric acid and the silver nitrate, and then centrifuging it, et cetera, as they go through. So you can see that the instructions that USP provides for this chloride test are definitely not straightforward. And so we have, and I'm sure that every third-party laboratory out there takes the information in these tests and breaks it down into something that makes, that's more stepwise for the analyst. And so what we have done is create templates that we have interpreted what this says, put it in a template, and it says, if this is an amine, take 3 test tubes. If it's not an amine, take 2 test tubes. And we go on through with this created a precipitate, this dissolved it, this does not dissolve it, so that it's a lot easier to follow. Okay, I'm going to have to skip off of the monograph at this point because the only test that we had in the ID test for lidocaine hydrochloride was the chloride test. Chapter 191 actually covers a very large number of tests, and they are all ID tests for elemental cations or complex anions such as benzoate or citrate, and then also some native elements as well. These tests are all qualitative evidentiary tests, and they are all identified through either color changes or precipitations or effervescence. The primary point that I'm trying to get across in order to properly identify your product is you need to run all of the ID tests in the monograph because there's not a single test that can identify the material on its own. The next test listed in the monograph is the assay, which is a test that provides the concentration. The assay in the lidocaine hydrochloride is an HPLC test. And there's actually quite a bit of information in the monograph, but it's the general chapter, which is 621, that actually tells you how to run the test. But the monograph provides the information on the instrument setup, the solutions to be used, and the system suitability requirements. And then, of course, down here at the bottom are the specifications for the test itself. Once the sample runs through the instrument and we get the chromatograms, we put that information into an Excel template to calculate the final result, which was 99% for this particular sample, which is within specification. While today's assay, while the assay for lidocaine hydrochloride is an assay, or as an HPLC, the assay test can be performed by several different methodologies, including GC, UV, and even titration. Assay tests are nearly always calculated on the Dreider and hydrous basis, and occasionally on the ignited or the solvent-free basis. And this means that the assays themselves are rarely tested alone. They generally must include a loss on drying or water, and occasionally they may include a residue on ignition or a residual solvent. In our sample, the specifications are 97.5% to 102.5% on the anhydrous basis. So the accompanying test that we have to run in order to calculate that assay is water. Water is run via the car-official titration, which is a more automated version than your standard burette type titration. The specification for the water is 5 to 7%, and we got a result of 6.3%. Related to water is the LOD, or loss on drying, but they're not the same thing. The water test is looking specifically for the water concentration in the sample, while the LOD tests for all the volatiles in the sample. That would include water, but also other solvents like maybe ethanol or acetone or something like that. The LOD test is a very manual test, and it's conducted in a vacuum oven or a desiccator, often with heat, to drive off those volatiles. After the assay In the monograph are a series of impurities tests, and there are 3 of those in this monograph. Residual on ignition and sulfate are both looking for inorganic tests, and the organic impurities for lidocaine hydrochloride is another HPLC test. Chloride and sulfate tests for impurities testing or turbidity tests. In this sample, a standard is prepared at a specific concentration, and a sample is prepared, and they are evaluated side by side. The point of the test is that the sample cannot be more turbid than the standard, and you can see that the standard is barely turbid at all, so the limit for this test is very low. The sample is no more turbid than the standard, and so the sample passes this test. Our limit is not more than 0.1%, which is the concentration of the standard in the Nestler tube there, and our result is less than or equal to 0.1%. This is a visual assessment, and so it is somewhat qualitative, and there's no way that we can give an absolute concentration by the visual assessment. Now, there are turbidity tests that do use instrumentation, but this particular monograph does not. The other test is the residue on ignition. It's an ash test. And so a certain amount of sample is added to the crucible and is digested with sulfuric acid, and then it's heated until there's no more fumes. Obviously, this is all done inside of a fume hood, because the fumes are actually fairly noxious. Once there are no more fumes, the sample is put into a muffle furnace at 600 degrees centigrade for several hours. The remaining material is the residue that we measure, and the limit for this test is not more than 0.1%. When we ran this sample, we had a result of 0.01%, and so there are very few inorganic impurities in this sample of lidocaine hydrochloride. The organic impurities is an HPLC test in this monograph, but the organic impurities can also be ran via other technologies such as GC or TLC, which is thin layer chromatography. The purpose of the testing is to determine if any of the impurities are above specified levels. The table, which is this smaller section right here, lists out any known impurities impurities that are known, and then we can identify those in the chromatogram by relative retention time, and then we can determine their concentrations in a similar manner to the way we did the assay by inputting that data into an Excel template, Excel worksheet that we've developed for the purpose. In this case, there are 2 known impurities up here, and but we did not find either of those known impurities in the sample, and we found very, very small, a limited amount of unknown impurities, and they were all well below the required specifications. Now, there's another impurity test, and this one is not found in the monograph at all. Residual solvents is intended to be tested with every raw material, and the purpose of the test is to determine if there are any solvents remaining from the manufacturer or the extraction and purification of the product. The solvents are actually broken down into 3 classes. There's class 1 solvents, and these are solvents that need to be avoided, either because they are highly toxic or they are an environmental hazard. The next is the class 2 solvents, and these are solvents that need to be limited because they can be harmful, and there are 23 of these that we have to look for. And then there's class 3 solvents, and class 3 solvents are not generally very dangerous at higher levels like the class 1s and class 2, but they are very commonly used, and so these solvents have been validated for the test. Now, residual solvents actually not only has 3 classes of solvents to look for, we have 3 different procedures that have to be followed. Procedures A, or can be followed. Procedures A and B are both qualitative limit tests, and procedure C is a quantitative test. So the question is how do you know which test to run when you're sending your sample in for testing? And this is actually one of the reasons why you might be asked for the C of A. If the client does not designate which procedure that they want, then it automatically defaults to procedure A. But if I can obtain the C of A from you, it may be that the solvents that were used in manufacture are listed on that C of A. And if they are, then we could actually test by procedure C and go straight to the solvents that we're looking for instead of having to do a qualitative limit test. The procedure C is faster to run, and it's less difficult to assess. In procedures A and B, the sample is tested against those three classes of standards, and we have to compare all the peaks we find in the sample to the peaks in those standards and determine if their areas are higher or lower. And the difficulty is that the sample may have other peaks from matrix effects or other things that may actually coincide with the peaks from the standard mixes in the sample. So procedure A is what we have to start with, and if procedure A fails, then you have to move to procedure B. And if procedure B fails, then you're looking specifically at the peaks that are not passing, and then you test those as a C against those particular solvents. So it can actually get rather expensive if you're having to go through all three sets. But if you know what those standards are to begin with, and this little tree diagram helps you here, but if you already know, then you can actually go straight to C, which saves a lot of time and effort and money if you were to have problems going down this particular route when you don't know. Okay, in addition to the residual solvents test, there are other specific tests in the monograph. And in the sample that we look at today with lidocaine hydrochloride, the only specific test that was listed was water, and we've already gone through that one. And of course, LOD is another one that you'll find in some monographs. But other specific tests that may come to be, based upon what the API is. If the material is optically active, then one of those tests is going to be a specific rotation. You might be asked to run a pH. You make the solution or dissolve the sample on a certain amount of water and measure the pH. Or it could be a melting point, or a specific gravity. And there's others out there as well, but these are the most common. So finally, we have finished the testing of the lidocaine hydrochloride test, and so now there's another C of A to look at, and that's the one from the third-party laboratory. Just like the manufacturer and the repackager C of A's, this C of A contains all of the tests that are ran, the specifications of those tests, and the results of those tests, as well as the date that those tests were performed. On our sample here, everything passed, and so we were able to release this C of A to the client with no questions. But things don't always pass. Sometimes you have a sample that does not meet the specification of USP. So we're going to go through two or three out of specification examples. This is a sample of hydroxycobalamin that we ran the assay and found it to be at 92.6%. The specification for the sample is 95 to 102, so you can see that it was actually below specification. So fortunately, the client did request further testing, and one of the tests that they asked for was related compounds. And in related compounds, there was a known impurity that was found to be at 44% or 0.44% concentration of the total compound, but the limit was 0.4%, and so the sample failed this particular test as well as the assay. Now, hydroxycobalamin is known to be light sensitive, so in order to ensure that the impurity in the low assay didn't show up as a result of the way we managed the test, we retested it in duplicate with another analyst in a manner to ensure that there was absolutely no opportunity for light to meet the sample and contribute to its degradation. That retesting in duplicate provided similar results for both the assay and the related compound, and so it was confirmed that this particular sample did fail to meet the specifications of USP. So in this particular example, the assay gave the first clue that there was a problem. The additional related compound test provided one explanation of the low assay result, and there may have been others as well, but we had two tests that failed to meet specifications. Assay may not, however, indicate the problem with the raw material. There may be instances where the assay and the ID test meet specification, but the sample is still inappropriate for release. And in those cases, testing for only the ID and the assay can lead to issues downstream. So this sample is a I cannot pronounce that, I'm sorry, chromalin sodium was analyzed, and the ID test fell within specification, and the assay had a specification range of 98 to 101%, and it gave a result of 99.3. So it was well within specification. But the client also asked for organic impurities to be tested, and so we did that. There is a specific impurity that showed up in this particular test that had a concentration of 0.18%, but the limit for this impurity was 0.10%, and so it failed to meet the specification. Again, to ensure that there was no laboratory error, after review, the sample was retested in duplicate by another analyst, and similar results were obtained. So the out of specification was confirmed, and the C of A was released as not meeting the specifications of USP. The important point here is that if no other tests were performed, the contaminant would not have been found. Full USP testing was completed, and so the sample did not meet specifications for release. Occasionally, USP will include a very special impurity test, one that is known that could be harmful to the patient. And this compound of polyethylene glycol 600 was tested, and the assay met specifications, as did the other intrinsic tests such as pH, residue, ignition, etc. But the specialty limit test that's listed in the monograph of limit of free ethylene oxide and 1,4-dioxane failed to meet the specification for ethylene oxide. So the limit for the test is less than 10 part per million, but the test provided a result above that level. Of course, again, this was retested in duplicate by another analyst, and the level was a very similar result was obtained. So in this case, failure to meet the specification would not have been detected if only the assay itself was tested. So the importance of raw material testing, in summary, is that, well, the things to know is that the manufacturer's C of A is the official C of A for the material. The third-party lab testing is confirmatory of the manufacturer's C of A. So if the manufacturer's C of A is the official C of A for the material, the question comes up as to why do you even do the testing? And the short answer to this is that things happen. There may be issues during shipment or storage that may have affected the integrity of the material, or it may have gotten too old, or simply in handling of the material, opening containers, closing containers to get aliquots out. Any number of things can happen that can cause the sample to degrade. So it's important to do the testing in order to ensure that nothing has happened since the sample has been manufactured to cause it to degrade or become otherwise contaminated. And one of the really important things that I am trying to get across in this particular lecture is that testing of only the ID and the assay may not reveal other issues with the sample. So I did leave off a point here that probably should have put further up at the top, is when you run the ID, all of the ID tests need to be run in order to confirm that identity. And then if you only do the series of ID tests and the assay, then you may not actually get a full picture of the quality of the product that you're trying to use to produce your product for your patients. There's a number of raw material sources available for you to understand the regulations associated with your raw materials and the testing. And this is a list of references that we used for this presentation that you are welcome to evaluate as well. And
now we'll go with questions. Thank you so much, Cynthia, for that fantastic presentation. And we encourage all attendees, you can submit questions using the questions tab, and we'll get started. The first question, what do we do when lab test results differ from the manufacturer's C of A?
well, the thing that you have to remember is that the laboratory, the third-party lab, is a confirmatory test and not the manufacturer. So the manufacturer is your primary C of A that you would use for yourself. So we're confirming that your product still meets the specifications outlined in USP. Now, some of our clients have their own rules for what they accept. I had a client several months ago that we obtained an assay level of, I think it was something like 98.8%, which was within specification, but the manufacturer C of A had a 99-point-something%. And they had their own rules in their facility that said that we had to be within, so much percentage of matching the manufacturers, and so they actually asked for the sample to be retested. So that decision is really up to you, how far you want, but the main thing that you want to get from the testing from the third-party lab is that your sample meets the specification of USP.
Great. Question number 2, how do we test for an impurity when there is no reference standard for such impurity?
Okay, not all impurities are known. Reference standards for impurity tests are obtained whenever those can actually be isolated. So usually those materials would come from side reactions during the synthesis of the material, so that they can actually be isolated and collected, so they can be used as an impurity reference standard. So other impurities will still show up in various tests, especially if they're chromatographic tests like HPLC or GC. And the impurities are going to be other peaks that are showing up in there that are not identified. And USP always has a limit amount for those impurities, and they call them unknown impurities. And so we have to calculate the percentage of each one of those unknown impurities. And then they also have a requirement for the sum of the total unknown impurities, and then they will have a requirement for the sum of all impurities, whether they are known or unknown.
Great, thank you. And as a reminder, attendees can still submit questions, and we'll work through those. The next question is, if the manufacturer labels a material USP, is it a requirement that the C of A match the USP monograph?
Yes. Anytime a manufacturer is going to claim that something meets the requirements of USP, or they're going to label it USP, then they are stating that it meets the requirements of the specifications of USP. And the same goes with the European pharmacopoeia or the JP. They simply have to meet the specifications for the material they are advertising, that it actually meets those specifications.
Thank you. Next question, at what percentage match do you retest the IR ID test? Less than 98.2%? Question?
Okay. That's a good question. IR is it's a qualitative test. We automatically accept it as a match from 98% and above. Okay. But a low match on an IR does not necessarily mean that it's not the correct material. Things called polymorphisms occur in inorganic compounds, and those are actual structural differences based upon when it crystallized out. What was the structure of the molecule, maybe whether it was cis or trans or something along those lines, whenever it crystallized out. And so in those particular cases, then you may not get a very strong match. And so what you do is you recrystallize the sample so that they're in solution, both the sample and the standard, so they're in solution at the same time, so that they're in solution at the same time, so that they crystallize at exactly the same time, so that they're under the same environmental conditions, and most of the time that will bring the match up. Now, if it is less than 97%, 98% for them, if my analysts are very well experienced, I allow them to approve a match if it's greater than 97%. If it's less than 97%, they bring it to me, and then I decide if it's a match. And usually, what might make it a lower one are simply environmental effects, or if we had to collect the sample by KBR instead of running an ATR, and the KBR is potassium bromide that the sample is diluted in and the pellet is created. Those don't often create as strong a match as something that is put directly on the instrument itself. So we can accept it going down a little bit. If it gets below 93 or 92%, then I'm actually going to bring it over to our scientific director here, and she will evaluate it and tell me if there's certain things that she knows from her experience that we can do, or it may be that the material itself is not pure. And we're going to figure that out as we continue testing. And these tests are not done in order on the monograph. There's typically anywhere from 5 to 15 tests in a monograph, and I have analysts assigned to different tests throughout the whole thing. So a lot of these tests are being done concurrently as well. And if your API is not pure, it's going to come out in something else as well.
Thank you. Next question. How would the acceptance criteria differ for impurity testing for substances that only have a USP dietary supplement monograph but are being tested for pharmaceutical purposes?
Can you read? I'm sorry. Can you read that?
Example, methylcobalamin injectable.
Read it again.
Okay.
Sorry.
Sure. How would the acceptance criteria differ for impurity testing for substances that only have a USP dietary supplement monograph but are being tested for pharmaceutical purposes? Example, methylcobalamin injectable.
Well, if I were testing a dietary supplement to be used as a pharmaceutical, then I would think you would want it to meet the specifications for the pharmaceutical impurity test. And that way you've got the purest material for your product. Yeah, that's true. We've also have to take into account route of administration, that sort of thing. That's something that I'm willing to study a little bit more and get back with you with a clearer answer on that particular question.
Okay, great. When an API has been determined as degraded, what steps do the repackaged and manufacturer have to take? More specifically, should we ask for an investigation report by the repackager, and does this include notification to the manufacturer?
Well, that part is actually out of my hands. But there is generally quite a bit of conversation that goes back and forth. So when we have something that has failed, we notify the repackager that this thing is that it has failed, and at that point they are going back to the manufacturer and talking back and forth. And I can tell you, it's never a situation where the manufacturer says, "Oh, okay, thank you for the information." It's always a denial. Typically, they do retesting themselves on their retained material. They will ask for the data that we've produced in detail, and then they will have suggestions for things that maybe we should have done differently, The problem is that we follow USP. So unless it's something that's allowable by USP, we can't just make changes to make things pass. That would be unethical. But there is generally quite a bit of conversation back and forth, and I can tell you that we have had products that we have tested here that the repackager has then refused and returned to the manufacturer. And they did not want it because they couldn't resolve the issue, and they chose not to trust the test that we performed as opposed to what the manufacturer was telling them.
Wonderful, thank you. And we have a little bit more time for questions. If you want to continue to submit those, we'll work through those. Next question, would you briefly talk about USP 61 and 62 testing? We also have Brian Kelly, our Director of Business Development here, and Cindy.
Yeah, I'm actually going to let Brian take over that particular. All I can tell you about 61 is it's a microbial assay, but it's microbiology and it's not my expertise. So Brian's going to answer that question for you.
Hello, everyone. This is Brian Kelly. So USP 61 and 62 are tests that are typically for non-sterile drug products. And so 61 is a test that gives you the total microbial load in the sample, if you will. So the end result of that test, it's actually two results, but it tells you how many colony-forming units are present in the material. Like I said, it consists of two separate tests, so you do get to two results: total yeast and mold, and then total aerobic bacterial count. So two results. If you're going to perform the test, look in Chapter 1111, gives you the acceptance criteria for that test result. And then also where 1111 comes in handy is it tells you which tests to run as part of USP 62. Now USP 62, so 61 looks at total counts. 62, you're confirming the absence of specific organisms, microorganisms. So 1111 tells you which ones to test. So, for example, like say it's a capsule, something that's going to be taken orally. It's a capsule, it's a non-sterile product, so it doesn't need to be sterile, but you don't want a huge microbial load, and then so that's 61, and then 62, you also want to make sure that any of the microbes present are not something that can survive the GI tract, so that might ask you to test for something like E. coli or salmonella or something.
Great, thank you very much. Thank you all for this fantastic session. As a reminder, Cindy's information is on the slide, and if you have additional questions, feel free to email her. In order to receive CE credit for this session, please fill out the evaluation link found right here on this slide deck, and it'll walk you through the questions, including your NABP number. And as soon as you submit that evaluation, the credit will be automatically applied to your NABP account. This link will be open for 2 weeks in order for you to take the survey. We also invite you to attend an additional CE opportunity, the Quality Compounding Summit, which is November 5th through the 6th. And we have 9 hours of continuing education credit from industry experts across the United States. It's going to be an excellent conference. The registration, you can register at www.qcsummitrx.com. And we also have a code here at the bottom that'll save $50 off registration. It's ARLQCS. Thank you so much for attending today's session. Have a good afternoon.